Armed conflict in Yemen has not only affected people's physical health, but it also reduced their access to health care, education, and food. This has created serious mental health disorders among them. This report has more details.
Yemen's 9-year conflict has not only destroyed houses, killed hundreds, displaced thousands, and deteriorated economic and living conditions, but it has also taken a toll on people's mental health. Patients who had experienced chronic mental health issues before the start of the war were severely impacted by the fighting and the lack of access to mental health care. Over 5.5 million Yemenis, or 1 in 4, are estimated to have mental health disorders that call for medical attention.
The number of mental health patients has increased as a result of the war, and many have families who need support.
Access to care for those suffering from mental illnesses is extremely difficult in Yemen. As of 2020, the country has only 58 psychiatrists and 120 psychologists, and there are major shortages in other associated cadres, such as psychiatric nurses, social workers, and psychologists.
The conflict has allowed for the proliferation of psychological and mental illnesses, such as ACD and dissociative disorders, among others. When people are deprived of therapy and treatment, they direct their trauma towards their households. In many cases, untreated individuals use physical and verbal abuse to express their unchecked emotions.
In Yemen, the majority of people who have mental health issues wait until their symptoms are already having an adverse effect on their lives and the lives of their families before seeking help and therapy. There are several reasons for this. Many patients fail to detect the early signs and become aware of them only afterwards. This is primarily due to a lack of understanding about mental health conditions. Some people try various conventional methods before going to the clinic for help. The association of mental illness with insanity and stigma also prevents patients and their families from seeking treatment.